If you're on your way to becoming pregnant, if you're pregnant, or if you're postpartum and wondering, what if I sneeze and I leak? What if I give birth and I have trouble controlling myself? What if I have pain during sex? This episode is for you. Today, you're going to meet Dr. Sara Reardon. She is a pelvic floor specialist, the founder of the Vagina Whisperer and the VHive app, and the author of a book called Floored, all about pelvic health. She's going to share with us how to think about peeing, pooping, postpartum, pregnancy, and sex, and how to improve all of these areas of our lives with pelvic floor health. From our Building Your Family community, this is the Building Your Family podcast. I'm your host, Lisa Schumann, author, researcher, and reproductive medicine therapist. Welcome back to the Building Your Family podcast. I am so excited to have you here. Today, we welcome Dr. Sara Reardon. She is a pelvic floor health specialist and will teach us why it's so important to take care of your pelvic health and how it can help you in all of these areas and how we can think about our lives and our bodies in a different way than maybe we've ever thought about before. So thank you for coming, Sara. I'm so happy to have you here.
Thanks for having me.
So could we start with this idea of pelvic floor? Because as I mentioned to you, I feel like there's just so many ways that you could help us. So what is a pelvic floor, just to get started, and how do people understand it?
So your pelvic floor is a basket of muscles that sit at the very bottom of your pelvis. So if we can all envision that ring of bones that sits at the base of the spine, maybe you've seen it in a doctor's office or on little kids' pajamas. And at the very bottom of that is this basket of muscles, and those muscles support your pelvic organs. So in the female body, it supports the uterus and the ovaries, the bladder, which holds urine, and the bowels, which hold stool. In a male body, it supports the prostate, the bladder, and the bowels. And these muscles also have three openings. One where urine exits the body through the urinary sphincter, the anal opening for bowel movements, and then the vaginal opening in females for vaginal birth, vaginal intercourse, and also menstruation. Male bodies have two openings. So all genders have a pelvic floor. This muscle, not only does it help with sexuality, reproduction, bowel and bladder health, but it also supports our core. So it connects with our spine, our abdominals. It contracts and relaxes throughout the day when we're breathing and lifting. So it's really integral to our day-to-day function, yet we don't often talk about it unless we're having a problem with it, like leakage or pain, and then we're seeking help.
It's so interesting because this is a whole new world for many of us. We actually just had an episode talking about how to keep yourself in good health through this process. And our guest kept on talking about pelvic floor through the entire episode. It's amazing how many applications there are. So let's just kind of start at the beginning. As we're going through the process of fertility treatment, and of course, there's a lot of stress involved, I suspect that there's some applications for that, some ways that we can help ourselves have a stronger pelvic floor and might maybe help ourselves through this process since there's so much, I guess, vaginal intrusion.
Absolutely. So, when you were pregnant, your pelvic floor muscles were supporting a growing fetus. And throughout the course of pregnancy, as that fetus grows, the pelvic floor muscles stretch to support that growing baby. So if you think about, we often compare a baby to the size of a fetus to the size of a piece of fruit. So you may say your baby's the size of a lemon, and then that's not that big. But at the end, if it's the size of a watermelon. So if you think about a hammock of muscle supporting a lemon, it's not going to change that much. The hammock's not going to sink down. It's not going to stretch. But if you put a watermelon in a hammock, that hammock is going to sink and stretch. And that's what happens to your pelvic floor during pregnancy. So pregnancy itself changes your pelvic floor, regardless of what method of birth that you have. So prior to pregnancy, some really great things to do would be to start kind of connecting with your pelvic floor, strengthening your pelvic floor if you do have if you're kind of at a baseline. Again, if we know that our muscles are going to weaken during pregnancy, we want to go in with kind of more in the tank, more muscle tone down there versus if we hadn't done anything. So I think that's a really important piece. And then another piece is also understanding how hormones can affect your pelvic floor. Oftentimes, many women are, taking progesterone shots or suppositories, and progesterone can actually lead to constipation. And straining with bowel movements can weaken your pelvic floor over time. So you may be entering into pregnancy with kind of a suboptimal pelvic floor as a side effect. So some of the things are kind of learning how to poop properly, learning how to pee properly, strengthening this muscle to get it optimal prior to pregnancy.
I didn't know that there was a correct way to pee and poop, and I'm definitely going to ask you
you will,
about that.
you will after our conversation.
Yeah, that's amazing. But first, I just want to ask you, because a lot of the people who listen to this either have a partner or they're going through it themselves, or they may have a surrogate who is continually going to the doctor in the beginning, having lots of ultrasounds, many more than you have when you have your kind of natural pregnancy. And so people get anxious through fertility treatment. And I understand that pelvic floor health can be really important because women tend to clench up a lot and get very anxious about continual, intrusions, and feel so stressed about it that I guess it makes them feel nervous that they're going to have more and more difficulty as time goes on. And it's going to be harder and harder for them to have these procedures.
Absolutely. So, I always say the body keeps the score. And I think when we are experiencing something that causes an upregulation of our nervous system, whether that be a singular trauma, whether it be medical challenges or complications, even just multiple doctor's visits and the stress of navigating fertility treatments, our body tends to hold on to that tension and stress. So for someone like me, that tension and stress settles into my neck and shoulders, and I get migraines and headaches, and I need massages and acupuncture and yoga. Well, for many people, that tension can also settle into their pelvis and their pelvic floor. And that can lead to overactive or tense pelvic floor muscles that contribute to straining during bowel movements or constipation, a hard time starting your bladder stream or incomplete emptying, and pain or discomfort inserting something into the vaginal opening. The vagina is a canal, a muscular canal, and the opening is kind of a ring of muscles that can close up to prevent anything from entering, but also relax to allow entry or exit for a vaginal birth. So I think that there's a lot that we can do. I know there's a lot we can do for pelvic floor muscle relaxation when somebody tends to guard. I think the challenge is we often say like, oh, just relax, or it's all in your head,
Right.
but there's a physical and psychosocial component to this. So we want to make sure that we're addressing both. And as a physical therapist, we address the physical piece.
I would imagine that a lot of these women, as you mentioned, have trouble also with their sex life during this time, because not just for emotional reasons, but also because they feel tense. So, what are the things that they can do so that they can, apart from the psychotherapy part, from the physical part, how can they relax their pelvic floor so it feels less problematic or painful during sex or during the insertion of their ultrasound machine?
So I want to assure people if you are experiencing discomfort with intercourse or even an aversion to it, you are not alone. Again, there's so much that you are going through from a very physical perspective and a very emotional perspective that it makes total sense that you may clench up or tighten or kind of guard in this area. So you're not alone, and there's definitely things that can help. So, from a muscle perspective, a lot of what we do is just to start with breathing, because our diaphragm sits underneath our rib cage and our pelvic floor muscles sit at the very bottom of our pelvis. And when we're tense or tight, we tend to hold our breath and clench our muscles and breathe in our chest. And so it starts with just taking what we call diaphragmatic breaths. And that's placing your hands on your rib cage and taking big, deep inhales, and think about your ribs opening up like an umbrella. So not into the belly, not into the chest, but the ribs opening. And that helps the diaphragm contract and relax and allows the pelvic floor muscles to relax. So if everybody's like, how do I relax? I'm like, the first thing you have to do is breathe and breathe into your diaphragm. That's going to relax your pelvic floor muscles. It's going to quiet your sympathetic nervous system. The other thing is to really focus a lot on relaxation stretches and more yoga type activities. These muscles are like any other muscles in your body. If they're tight and tense, we need to unwind and soften and relax them. So, some great yoga stretches are child's pose or happy baby pose or a deep squat called malasana in yoga, a butterfly stretch, kind of really releasing tension in the hips and pelvis that can cause a lot of muscle guarding in the area. And in my app, the VHI, I have all of these little 5 to 10 minute stretches that really you incorporate this breathing into the stretch routine. And it's very simple, but it helps us unwind from all of this tension that we hold in the area throughout the day. And then I encourage people to do that before sexual activity to kind of quiet their nervous system and their muscles. And there are different devices called vaginal trainers or dilators we teach folks to use to insert into the vaginal canal to help, coach them through that without muscle guarding, and even an internal massage device that can release pelvic floor muscle tension. And again, I have videos on how to use those in my app, but there's a lot that you can do at home to really approach these muscles to get them to soften and lengthen and not associate pain or discomfort with something, which can help you minimize guarding when you're going into that activity.
That's fascinating. And that's amazing how you can breathe and then it changes your pelvic floor just from your breathing in your diaphragm.
Right. So if you're kind of sitting here listening, I kind of encourage you to like hold your breath and then try to tighten your pelvic floor. Like it's really hard to do, right? Because you need to both to be moving. So it's one of those things where I teach people like it starts with your breath and then you bring that breath into your yoga stretches, your dilator use, your sexual activity, using the wands, having a vaginal wand inserted during an ultrasound. So a lot of those things can just give you tools in your toolbox to help soften your pelvic floor muscles and quiet your nervous system.
And then what about the peeing and pooping part? How do we know that we're not doing that the wrong way?
These are the basics, I think, pelvic floor 101 that I wish we were all taught, even as young children, so that when we are adults, we have the right strategies and tools in place before we even go through physical experiences like fertility treatments or pregnancy or birth. Again, these muscles support your bladder, and there is a tube that runs from your bladder out through your urinary sphincter. That's called the urethra. And your pelvic floor muscles kind of clamp and close shut that urethra to prevent urine from leaking out as your bladder is filling. And then when you sit down to go to the bathroom, if you're a female body or if you're a male body and you stand, you just relax those pelvic floor muscles, and your bladder is a muscle that pushes the urine out. So they kind of work in opposite. The pelvic floor relaxes, the bladder contracts to push the urine out. Some of the mistakes that folks often make with bladder health are they're hovering over the toilet when they pee. They're like, oh, it's a yucky toilet, or oh, I don't want to go in the hospital.
I can relate.
And right. And when you hover, you don't relax your pelvic floor muscles well. So you end up not emptying completely, which can put you at risk of a urinary tract infection. You may have to start going to the bathroom more frequently because you are not emptying well, or you may find yourself pushing or straining when you pee, which can weaken your pelvic floor muscles over time. Now, the pushing when you pee, so I encourage people to sit down. And then when you sit down to pee, lean forward on your elbows and kind of relax. And then don't push or strain when you pee. I call this power peeing. And I think that women and moms are notorious for this because we're always in a hurry.
Yes.
Sit, breathe, chill, allow your pelvic floor muscles to relax. And again, your bladder will push the urine out. And that one simple change of not pushing when you pee can actually help minimize pelvic floor weakness over time, so that again, going into pregnancy or birth, you've got less weakness in the area and more strength.
That's so counterintuitive because I would think, well, if you are not doing that, if you're not relaxing, then you're strengthening your muscles to work better.
So, these muscles are designed to contract and relax. And so when we're peeing, that's a time for them to relax. When we are exercising, that's a time for them to contract, right? We're loading our muscles more, we're carrying more weight. We need that strength there. When we're carrying a baby, we need that strength there. When we have a vaginal birth, we need relaxation. So we need both of those things. Unfortunately, the narrative around pelvic floor muscles have always been to just tighten, tighten, tighten. And
yes,
we are all tense and tight anyway throughout the day. So it's focused on contracting when we need the contraction and support, and then relaxation when we need the length and relaxation.
So I could understand, how is it helpful if you're relaxing on the toilet? Because I'm sure other people are curious about this too. If you're relaxing on the toilet, how is that helpful for your pelvic floor?
So relaxing just means like letting go. Like there's always a little bit of tension in this muscle, right? Because it's supporting our core. It's like our abs are always kind of working, right? Even though we can grip them harder, they're still supporting our spine. Same thing with these pelvic floor muscles. So we just talked about what is the best way to relax these muscles? To just breathe, right? To just breathe and soften and kind of let go of some of that tension. Or to get into a squatting position, which we talked about earlier. Like you can squat, but if you're on the toilet, putting your feet on like a little step stool can help as well. It's about if you're relaxing your pelvic floor muscles to pee, then you're not straining. And it's the straining that weakens the pelvic floor muscles, like the pushing your
Oh,
urine out. So you just don't want to push when you're peeing. You can push when you're having a vaginal birth. You can push when you're pooping. You just don't want to push when you're peeing.
and what about the pooping? Is there a rule? Are there rules about pooping also?
There's definitely rules about pooping.
Okay, let us know.
Again, something I wish we all learned when we were young. So for bowel movements, it's the same thing. We need relaxation, but the rectum is a container that holds stool or poop, but it doesn't push out like the bladder. So the bladder is like a balloon that inflates, and then when you relax your pelvic floor muscles, it pushes urine out. The rectum just whole is a container. So when you sit down on the toilet to have a bowel movement, I love for people to put a little step stool under their feet. There's these ones called squatty potties, or you can just use any type of stool. The goal is to get your knees above your hips level so that you're kind of in a squatting position while you're sitting on the toilet. And that squatting position, again, helps relax your pelvic floor muscles. So you put your feet on the stool, you lean forward onto your elbows. So you're squatting, kind of sitting on the toilet. And then you can push while you're pooping. So that's fine, kind of bearing down and pushing. But I don't want you to hold your breath. I want you to exhale like you are blowing out a bunch of birthday candles. So you're pushing, bearing down, but you're exhaling. So again, not to hold your breath, which can weaken your muscles over time.
I see. So the issue with hovering is that you're putting all your strength in your legs. You're not relaxing. It's not about having your knees up. It's really about just relaxing.
It's about, so for peeing, it's about sitting down, relaxing, just, putting yourself in a position where you don't have to hold your body into a sustained squat. You just can sit and chill. So that's for urination. For bowel movements, obviously you want to sit, but you want to get into more of that squatting position with your feet supported on a stool while you're sitting on the toilet. And that just kind of unkinks the hose of your rectum. It's like a little hose down there that has a kink in it so that stool doesn't leak out. And then when you put your feet up and get into a squat, it unkinks that hose. So there's like a smooth little chute for it to go through.
And how is that helpful to our pelvic floor?
Minimizes straining. So we don't want to
Oh,
strain. So that's ultimately what this all comes down to, right? These are this is a hammock of muscle. So every time we strain, it's like jumping on the trampoline. It's like pressure down. And a lot of women with, whether they're athletes or they're in older age, they'll tell you running, jumping, coughing, sneezing, anything that puts pressure on that muscle causes leakage. So we're trying to put steps in place. It happens during pregnancy. It happens postpartum, this leakage of urine. So we're trying to put things in place that will help minimize that.
I see. And if you do these things, then that just kind of protects your pelvic floor. So there's less chance of leakage.
Correct. Leakage, weakness, back pain, prolapse, a variety of things, hemorrhoids,
So all of those things can happen from not having a strong pelvic floor.
from overstraining. Yeah,
Wow. That's
I
incredible.
know.
So if somebody has back pain, how do they know that I have back pain because I've strained my pelvic floor too much?
So it's interesting because, we think of our core muscles, which when we think of back pain, we always say, I have to strengthen my core. But your
Yes,
pelvic floor is part of your core. Your pelvic floor is the base of your core, the foundation. So your core is your front part, your abdominals, your back part, your back muscles that attach to your spine. The top is the diaphragm, and the bottom is the pelvic floor. So this entire canister of muscles is really what's supporting our spine, giving us strength, giving us mobility, and helping support our back. So when there's a deficit in one part of that canister, it can cause low back pain. So there are some studies that have been done that over 90% of people, women who have low back pain, also have pelvic floor problems. Yeah, because
Wow.
that means their muscles aren't working, they aren't contracting well, they may not be relaxing well. So ultimately, what I would say is if you have back pain, do an inventory of your pelvic health. Do you have leakage occasionally with coughing, sneezing, running, jumping, urgency? Are you straining with bowel movements or have hemorrhoids or fissures or fecal leakage or staining in your underwear? Do you have pressure, heaviness in your pelvic floor? Do you have painful sex or pain with tampon insertion or pelvic exams? Kind of assessing all of the pelvic health concerns that you may have, and you have back pain, there could be some correlation between these two things.
And I guess there's no downside to working on your pelvic floor because that might help a variety of things.
A variety of things. And when we think about, core support when you are pregnant, I mean, your abdomen is stretching and growing and our core gets weaker. So again, this is one of those things that if you can build strength and connection in advance, it really will benefit you during pregnancy and then also during birth.
Imagine your beautiful future. You're snuggling with your child. You feel so connected to them. Your friends and family are so happy, and you have everything that you've ever wanted. I want this for you too, but I want more than that. I want you to feel secure knowing that you've made the best decisions, not just short term, but long term for your future family. Wherever you are on your journey, whether you're choosing a donor, choosing a clinic, learning how to talk to your donor conceived child about their origins, all of these decisions will have wider implications for your future. And I want you to have the right resources so you can feel empowered and confident at this very important time in your life. That's why I'm so excited to introduce you to Building Your Family. It's the only expert-guided platform designed for parents and parents-to-be using reproductive medicine. We provide unique strategies that you won't find anywhere else to make your path to parenthood smoother and more informed. And that's why our approach is about offering practical and actionable steps that you can use right now. Whether you're just starting out or already deep into your process, Building Your Family is here to guide you with expert advice, specialized education, stress reduction strategies, and a community to support you every step of the way. We can't wait to see you inside. Well, I think that's so helpful because, of course, not only is this important, but I think that there's so many people out there who really want to be able to have something to do while they're going through this, something that they can actually say, I have control over this area of my life. I can benefit my pregnancy and postpartum if I try these exercises. So, what do you recommend people do as they're preparing for pregnancy?
In full transparency, I don't want to add another thing to your to-do list. So if your to-do list is long and you're like, I already have to do this, it's like, I don't want to put another thing on you. So this should be something that it makes you feel good about your body. It makes you feel like you are doing something that's beneficial for you and your pregnancy and birth in the future. So I think kind of going into it with that lens is really important. And if it doesn't feel like the right fit for you at the right time, that's also okay. But I do think is like just paying attention to some day-to-day habits that you have, like your bladder habits. So in my book, Floored, I have different chapters on like, peeing and pooping and pregnancy and postpartum. And you can read the book in entirety, or you can just go to that chapter to say, like, what do I need to know day to day? And again, it goes over a lot of the basics of how to pee properly, what to look out for signs if you're having leakage, or because a lot of people actually start experiencing urinary leakage during their fertility treatments. So it's something that I want people to be aware of. If this is popping up sooner, it's a pelvic floor issue, and I want you to start getting support for it now. You don't have to just deal with it. So I think that's something to kind of be aware of. Just learn the basics of the peeing and pooping. You can start doing strengthening workouts. You can start doing yoga workouts. Again, all of this is available in my VHive app. And so it does make you feel just more connected with this part of your body that is going to go through a transformation and change. And you'll feel very prepared going into that process.
And then what about pregnancy itself? Should people continue these exercises through their pregnancy?
Absolutely. So, the research is very clear that movement, exercise is healthy for mom, it's healthy for baby, and it leads to better birth and postpartum outcomes. I think as moms, and I can say this because I'm a mom and I've been pregnant twice and given birth, is that we focus so much on the baby, the health of the baby, getting the
Yes.
nursery, everything that we need, but we're not really thinking about what does my body need? Maybe the basics of protein or foods or whatever, vitamins, but not the physical strength that we need to navigate this transformation. I always
Yes.
say pregnancy is like running a marathon for 10 months and then it's a 3-month sprint at the end. And then you go home and you have another human to take care of afterwards.
Yeah.
So, pelvic floor training and core training during pregnancy, knowing what symptoms to look for that you can get support for, whether it's pain or leakage or constipation or prolapse. Again, they may be common during pregnancy, but there's help for them. And then going into birth, I really think that women or moms, I should say, should get some childbirth preparation on how to give birth, how their bodies work to give birth. It's like we're asking moms to go into a hospital setting to give birth, and it's like telling them to run a mile when they don't even know how to walk yet. And so I think we really need to help educate moms on how do you push? How do you relax your pelvic floor muscles? How do you breathe? What are different positions that you can get in, even with an epidural? How do you recover postpartum, your first pee, your first poop, lifting your baby properly? So a lot of these things that you can do during pregnancy and in preparation for birth will help your postpartum recovery as well.
And so if you do these things during your pregnancy, then there's less of a chance that you'll have these other issues like problems pooping or peeing.
I think what I can't assure anybody will have less of them because there's so many factors like genetics and what number of pregnancy this is for you, different things like that. But I will say that feeling more educated and empowered during your pregnancy and birth has shown to have better birth outcomes. So, regardless of what method of birth you have, whether it's a vaginal birth or a cesarean section, women report higher satisfaction when they feel prepared. So, I think that that's a really important piece of
Yes.
information. The other thing is that, yes, the research is also clear that women who do pelvic floor muscle training have less leakage. So it's less back pain. So it is a really important thing that, a lot of doctors are just saying, oh, leakage is normal, wait till after the baby, or, back pain's normal, wait till after the baby, sciatica
Yes.
is normal. But working on it during pregnancy gives you better outcomes afterwards and helps your symptoms so that you can feel better. So again, I created this whole week by week pregnancy program in my app, and it's not like super hardcore workouts. I'm like, we need to really help these women train their bodies and understand how to support themselves instead of saying like, okay, you just sit on the sidelines for 10 months and then we'll deal with you afterwards, because it's a really
Right.
physical experience.
Yes, absolutely. I didn't even know it was possible. I mean, when the doctor says, we'll just, wait it out, you'll just have some leakage and then, you'll deal with it later or it'll
But can
all
you imagine if
be okay.
every partner that's what they were told? I'm like, what if
Yeah.
say you have, two people and like the one who's not pregnant is like, okay, you're leaking, but just wait until after. It's like, no, you can get help for these
Yeah.
things now. And again, it's very clear that that getting training during pregnancy is helpful, not just during pregnancy, but also postpartum.
That's great. And what about people who have cesarean sections? Is it helpful to them even though they're not having a vaginal birth?
Absolutely. So the pelvic floor changes and lengthens and typically weakens during pregnancy itself. So even if you have a C section, you are likely to have pelvic floor problems. Now, with a C section, there are some benefits to the pelvic floor. So if you have a vaginal birth, you're more likely to have pelvic organ prolapse or urinary leakage. If you have a C section, you are more likely to have painful sex and abdominal pain, scar pain, and sometimes painful bowel movements or painful periods. And the reason is because the incision in your lower abdomen cuts through 7 layers of muscle and tissue. So it's a major
Wow.
abdominal surgery. And
Yes.
then you are sutured back up. There's no rehab process in place for post C-section
No.
moms. And that's it. And you're told, like, go home, take care of this baby, and come back in 6 weeks. So we find that a lot of women have scar tissue restriction or tension in that area that really needs to be treated to help with painful sex, help with bowel movements and bladder emptying and all of these things because things get really tight and tense down there. So it's a different set of issues, but it's also a set of issues that definitely deserves being addressed.
Yes. And I've seen people have difficulty with scar tissue
Yeah.
years and years and years later. It affects their bowels and all sorts of things from having a C-section.
And the thing is with a C-section is once you have one, oftentimes the pregnancies afterwards will also be via C-section. And I remember this woman I was working with over a decade ago. She was probably in her 50s or 60s. She had 3 children who she had all given birth with via C-section. And she also had kind of a incision from a hysterectomy. But she was coming to see me for incomplete bladder emptying. She was having to pee every hour on the hour, just felt like she, starting to have urinary tract infections. And when I accessed her, it's not like she had tense or weak pelvic floor muscles. Her C-section scars were so tight and restricted that she wasn't emptying her bladder well. And all we did was work on her abdominal wall, deep scar massage, cupping, dry needling. And she started emptying her bladder within 3 to 4 weeks of just working on that abdominal tissue. And it was uncomfortable for her because it was decades restricted. But it goes to show you that even decades later, some of these symptoms can show up because of that scar tissue restriction.
So just to go back to what you were saying, because you mentioned dry needling, which I don't know what that is, and cupping, which I've seen in athletes. How do you put these things together to reduce scar tissue that's potentially internal, not just external?
So we work externally. So, a lot of the times I'm using my hands to work deep into the tissue surrounding the scar. So your abdominal wall, we have these different layers of tissue in our body. And, we've got skin and we also have what's called fascia. And fascia is this like kind of thin white layer that goes between our muscles or our muscles and our skin. And it helps everything glide and move. And when you have a C-section, that gets tacked down. But the fascia from the abdomen wraps all the way around to the pelvic floor. So if you have abdominal tension or restriction from a surgery or scar tissue restriction, that affects your pelvic floor because that will also get tight. So moving the tissue around the scar, cupping around the scar and all the fascia around it, even on top of the scar. And then dry needling is a technique that we use as therapists. Acupuncturists use it as well, where you can insert like a thin acupuncture needle and we kind of go around the scar or on the scar. And we use this electrical stimulation to kind of pulse it. And it's just really effective in releasing any residual muscle tension and bringing blood flow to the area. So kind of all these like little tools and techniques, but you can do this scar massage at home. I mean, I think it's, some people don't like to touch their scars. So that in itself can be therapeutic and healing for them. But also working to relieve some of these symptoms with deeper massage can be really helpful.
Wow, that's incredible. I
I
had no
know.
idea.
Well, and it's so
Fascinating.
connected. It's all, our abs and our back and our pelvic floor and our core. This is all so connected. And it's just so fascinating to me how much we focus on not the pelvic floor. We'll focus on the six-pack
Yes.
abs or get your abs back. But I'm
Right.
like, we just need to help people pee
Get
and
your
poop and have
endurance back.
sex. Right.
Right. That was my next question. What about sex? Does it help us with our sex life to have a stronger pelvic floor?
It helps us to have a functional pelvic floor. So again, these are muscles that we want contracting, but we also want relaxing. For sexual activity, if we're talking about something in the vagina, we want those pelvic floor muscles at the opening to be relaxed. We want those deeper muscles to be relaxed. Oftentimes people can report pain with entry or pain with deeper insertion because there's 2 different layers of pelvic floor muscles. We also want adequate lubrication. So if we have really good blood flow to these areas, if we've got healthy hormones, we get really good lubrication that can make vaginal intercourse more comfortable. We want tone to these muscles. So it does feel great when we've got more tone and strength. But again, we also need relaxation to be able to comfortably have something insert. And then, and another piece is that these pelvic floor muscles are also play a role in orgasms. So the outer layer of the pelvic floor muscles are part of the clitoris and the clitoral hood. And these are purely, the clitoris is purely a sexual organ. It's only for feeling good. And so when you've got healthy pelvic floor muscles, you can get good blood flow to the clitoris during arousal. You can get clitoral engorgement, and then you can have an orgasm, which contracts and relaxes these pelvic floor muscles. So stronger muscles, stronger orgasms, but tight, tense muscles, the inability to have an orgasm as well. So there's 2 components. I say that because I don't want people just walking around like tightening their vaginas all day. I think it's going to help them have better sex and orgasms, but
Yes.
it's the contraction and the relaxation of the muscle that's important.
They have to be able to do both.
They have to be able to do both.
That's great. And so how does one go about that? Because I'm sure people are going to wonder, okay, well, how do I apply this to my life?
Right. So, I think the first thing is we need to find out which track you're on. Do you have tension or do you have weakness? A lot of that can be symptom based, not completely, but it's a good starting point. I actually have a quiz on my website, which is the vaginawhisperer.com. And it walks you through different symptoms like, are you leaking? Do you have back pain? Do you have prolapse? How many pregnancies have you had? Do you have pain with sex? Do you have tailbone pain? So it kind of walks through different symptoms, and that helps kind of put you on which pathway should you go. Do you need strengthening? Do you need relaxation? Or do you need both? If you need relaxation, it's often due to tight, tense pelvic floor muscles, as you mentioned before. And you want to make sure that you're relaxing these muscles before you strengthen. You don't want to just do a bunch of Kegels and tighten muscles that are already tight. So again, that will look much more like yoga and breathing and some postural changes. And if you need strengthening, it's also not just Kegels while you're sitting in the carpool lane or at the red light. It's, contracting and relaxing that muscle, building up endurance, doing the exercises in different positions, not just sitting, but standing, walking, and then bringing it into movement or workouts, like at the gym doing squats and lunges or lifting weights.
Oh, interesting. That's
Yeah.
amazing. Amazing. And then the other question I was really curious about, Sarah, is that, many of our listeners are pregnant or has somebody on their team who's pregnant kind of later in life, as we would say. And when you're at this advanced maternal age, sometimes you're getting close to menopause or
Yeah.
perimenopause at the same time you're trying to get pregnant. So for those people who are facing this, what do you advise them and how should they start to think about pelvic floor health?
So I think there's a couple different phases to this. I think if we're thinking about preconception, the same thing applies. You want to be really working on building up tone of these muscles, addressing any kind of current pelvic floor issues that you may be experiencing. And then pregnancy itself, same thing. Working on strengthening throughout the pregnancy, but then also in that last trimester, focusing a lot on relaxation, learning how to push and birth and all of those things. The tricky part comes when we're postpartum. And the reason for that is because we're having babies later in life. And we also hit perimenopause anytime between 35 to 45. So postpartum to perimenopause becomes one blurry season when we
Yes.
don't know kind of where symptoms are coming from. Ultimately, what's happening during perimenopause, which is kind of prior to when menopause hits. Menopause is when you haven't had a period for one full year. During perimenopause, your estrogen levels are dropping significantly, and you kind of bigger issues you may experience are like hair loss, anxiety, sleeplessness, dry skin, vaginal dryness, pain with
Mm-hmm.
sex, more urinary leakage, urgency, waking at night to pee, urinary tract infections, things like that. But you need to be working on strengthening during that period and making sure that those pelvic floor muscles and vaginal muscles are getting lubrication, moisturization, sometimes topical estrogen. When you're postpartum, you also have low estrogen. Oftentimes, if you're lactating or pumping, you have low estrogen, which is why your period doesn't come back for many, many months for a lot of people, because you have high prolactin, and prolactin is what produces breast milk. So when you have that low estrogen, it's like you're in menopause or perimenopause, vaginal dryness, painful sex, weaker pelvic floor muscles. So you've got to be doing the same thing regardless of what stage you're in. I think one change I would make is that if you're in perimenopause, I really encourage people to use topical estrogen on the vulva and vagina in conjunction with pelvic floor training, because that estrogen isn't coming back on its own, right? So you've got to
Mm-hmm.
kind of supplement very locally with that while you're doing pelvic floor training. But I encourage folks that if you see some of these symptoms to start, like you had your babies a year or two ago, but then all of a sudden you're like, oh, I feel like I'm leaking more, or like, oh, it's like I need more lube during sex. Those are some of those perimenopausal changes that are popping up that are related to those hormone changes. And then also know your pelvic floor muscles may be getting a little bit weaker as well.
So they get weaker as we get older.
They do. They do. And
Mm-hmm.
this is why, just like we think about going into pregnancy, working in that preconception era to strengthen, we have to do that for menopause as well. You have less estrogen, less testosterone. Both of those help build up tone in the pelvic floor muscles. And you have less collagen. So we all talk about collagen for our face and our skin and our
Yes.
nails and our hair. Your pelvic floor also has a complex of collagen that supports your organs, keeps those sphincters closed. So when that collagen is not as present because we have less estrogen, that collagen isn't supporting our muscles as well. It's not supporting our organs as well. So you want to make sure that you're building up that strength because we have less of it kind of internally. I make this sound like
Mm.
terrible. I'm really trying to rebrand perimenopause as like a roadway of like preparation versus like doomsday. But,
Yeah.
I think it's important for folks to know that there's help for what they're going through. I think oftentimes we're just kind of living in the dark because
Yes.
nobody's telling us what's normal. Nobody's telling us what we can do about it. And so my real goal is to just let people know they're not alone and give them resources to really understand their bodies better, but also to help them feel better in what they want to do.
That's so important because so many of the women that I see who are using donor conception, they've had infertility issues, and many of them are in perimenopause or early menopause. And so they're already kind of, fighting this uphill battle to try to keep their body feeling young, being able to
Yeah.
have the sex life they want, being able to feel like they have some control over their body. And then as you're saying, you go into pregnancy and it's almost like a double whammy for a lot of these patients.
Yeah, and it's hard. I mean, I think it's so hard because we feel like we don't have control. But I think it's like control the things that you can, right? We can't control how rapidly these things can happen. But I think and often if you are trying to get pregnant at a later stage in life, there are so many things that feel very overwhelming and stressful. So can you manage your stress with some yoga and walking and whatever the case may be? Can you do some kind of gentle, like light exercises that aren't like going to CrossFit or Orange Theory, but they feel really therapeutic and helpful for your body and pelvic floor and core? So kind of it doesn't have to be so black or white. I think we really want to think about that middle area where it's like, what can we do that is really therapeutic for us, but also doesn't cause more stress or more on our bodies or even kind of just our emotional souls because we feel like we already have so much going on.
Yes, absolutely. And as you said, I think that this vaginal estrogen is, a lifesaver for so many people. It's really, really helpful. And it's so nice that you combine all of these things, Sarah, in your toolkit, the cupping and the estrogen and all of these things, which is really so wonderful because it's helpful for people to be able to see that there are lots of different pieces to this puzzle and lots of ways to treat their problems.
There really are. And, I always say it's like going to work with a pelvic floor therapist is like going to the dentist. Like, I really wish this was just like an annual tune up we all got to be like, how are
Yes.
things going down there? And then we say, you've got a little something going on here. Let's do this. Or we got to be better about this. So I really wish that that was the case. That would be my ultimate goal for pelvic floor therapy. So I think that, just the awareness of it is growing, which is wonderful. I think that, really working towards integrating this into every stage of life as a woman, whether it's, again, for young menstruators, becoming sexually active, through conception and preconception to postpartum and perimenopause and beyond. It's really thinking about how can we optimize this part of our body, just like we do with our hair, our skin, and our nails. Nobody's taught us about our pelvic floors and our pelvic floor health.
Mm,
So having these conversations, I think, really helps empower people to understand their bodies better and be proactive about taking care of it.
great. It's great. And what caused you to write this book, Sarah? Because as you're saying, there's so much here that people don't know. So clearly there was a need. But why at this point in your life did you say this is the right time?
I didn't really, I didn't say that really. Somebody approached me. I was really
Mm,
lucky. And an editor for HarperCollins followed me on social media and reached out to me in 2023 and said, hey, I think that you've got a really great voice. We'd really love to talk about having you write a book about pelvic floor health. And I was like, oh, I'm so busy. But I really wanted to do this because my passion is helping educate people about their bodies, particularly women. When this opportunity came, I had to make some kind of shifts in my professional life. I was owning a clinic at the time, doing my app stuff, running social media. So I ended up selling my clinic. I sold my practice and I work for
wow.
the two women who bought it. So Two of my employees at the time bought it from me, and I work for them now, which is like, yay, two more female entrepreneurs in the world, which is
Mm-hmm.
exciting. But then I spent a year writing this book. And what I realized is that you can walk into a bookstore and there is a book about everything else you can imagine. Hundreds of books about nutrition and mindfulness and even menopause now, but there's no books on pelvic floor health. And when you see a book on this, it's like, oh, I might have this problem. Like you start feeling less alone. Like there's somebody's bringing awareness to this. Somebody's educating about it. Somebody's giving you solutions. And I think that these issues are actually quite prevalent. 1 in 3 women will experience a pelvic floor issue at some point in their life. More women leak urine than have osteoporosis, diabetes, and heart disease, but we're not talking about it. So it's really
Right.
an effort to just expand that conversation and give people an affordable and accessible way to educate themselves and to get treatment. Doctor visits are expensive. There's not pelvic
Yes.
floor therapists everywhere. So how can, with the book in combination with the app, how can we really help people get the information they need at an affordable and accessible price too?
Yes. That's so important. So important. That's why I wrote my book and started my platform for the same reason. When you have information that you think people could really benefit from, it's so great to get it out there on a larger scale. So how can people find you, Sarah, and how can they get the app and the book?
So the app you can download both on Google and Apple. If you just check out the VHive app, it's there. It's like a little cute fuchsia box with a V on it that looks like a little beehive. And then my website is thevaginawhisperer.com, and that's where you'll find my quiz, and you can find the app, and everybody who downloads the app, you can try it for free for a week. I really want people to get a sense of, is this the right thing for me? But it's just such a beautiful project that we worked on. We really poured ourselves into it for an entire year. And there's videos for every life stage and pregnancy and perimenopause and painful sex. And then if you're on social media, my Instagram handle is the Vagina Whisperer. It's the.vagina.whisperer. And there's a ton of information on there. And I try to present it in a kind of funny, entertaining way as well. And then I'm on TikTok as the Vag Whisperer because TikTok doesn't like the word vagina. So you can find me on both of those platforms.
Okay. That's great. And is there anything we didn't cover today, Sarah, that you feel like people need to hear?
I think the number one thing we didn't talk about, but it's just kind of a point, is that I also want people to feel like it's never too late. We talked a lot about how during pregnancy, do this, after pregnancy, do this, before menopause, do this. But no matter what stage of life you're in, it's never too late to get support and help. And you will do it when you're ready. I think that I was 18 months postpartum when I went to my first pelvic floor therapy appointment. And I had been a therapist. I was just kind of drowning in life for a bit, and I just didn't have
Mm,
the space to take on more. And so it's never too late. I think that you deserve it. I think we often put ourselves last when it comes to healthcare because we're taking
yes.
care of everyone else. And I really think that we deserve this care. It should be integral into our experience as healthcare consumers. It's not yet, but there's definitely help that you can gain from it. So I just want to encourage you to check it out if and when you're ready.
Yes, I think this is great advice. And also, I think for all of those professionals out there, it's such a great idea to bring it up when you see your patients, right? If you're going through fertility treatment, or even if you're a gynecologist, you have a captive audience once a year to talk to about these things. And so many people don't know about it, and patients probably just don't bring it up.
Yeah. The research is clear. If medical providers don't ask about these symptoms, patients don't tell them. And so it
Yes.
is important to kind of get outside of our comfort zones as medical providers and ask those questions. And then again, there's so many avenues. It could be in-person therapy. It could be an app. It could be a book. It could be telehealth. There's so many ways to access pelvic floor care now.
It's wonderful. Well, thank you so much for all you do, Sarah. It's so fantastic. And I can't wait to dive into it more. I'm definitely going to get the app. I love all the things that you're doing. And I hope everybody out there listened because this is great information. And while we're here, please press subscribe. If you stayed to the end, then obviously you like this material and we want to give you more of it for free. So press subscribe so that we can make sure that you can keep coming back and get more of this helpful material.
Thanks for having me, Lisa.
Thank you, Sarah. I hope you enjoyed that episode. And if you want more information about fertility treatment, donor conception, surrogacy, or early parenting, please join us for one of our live workshops. Our workshops live inside of our membership community, but we offer them to the public completely free of charge. So make sure you look at the information in the show notes and join us. We hope to see you there.